We're about to get into the deep end of the pool here when it comes to Medigap, comparing Plan G to Plan N. You know, a topic that I've touched on a number of different occasions. I've touched on Plan F compared to Plan G, Plan F and G compared to Plan N, etc., because this is, kind of a central question whenever you're choosing Medigap. The video is pretty comprehensive. That all said, there are limitations to what I could actually say in the public YouTube channel. And to address the things that I cannot say, there's GH2 Unfiltered. GH2 Unfiltered is a subscription site. For first-time subscribers, I'll send you my book, Maximize Your Medicare, published in 2020 by Allworth Press. I'll send it to you, and I'll pay for shipping anywhere in the lower 48. You can ask me reasonably why, there's a subscription site. And the simple reason is, there's the information that I can provide in public. But beyond that, getting from there and how a person would actually decide is slightly but importantly different. There's extra information. There's the actual execution. There are important steps in here. And then, of course, there's price. We'll get into price in the video. These three things I can't really share with you in public. And there's a reason for that, which is, that I'm highly regulated. And more importantly than that is the fact that the information can be outdated. It can change through time. You'll want to have, razor's edge differences because that can make a difference to you. In addition to that, the fact of the matter is that these extra steps are so important that they can overwhelm the differences here that I'm actually going to be reporting to you. So in other words, these extra pieces of information I can't set out here in public, and I don't want to be misinterpreted by the listener. As a result for that, we've got GH2 Unfiltered. Again, gh2unfiltered.com. The reality is your first year subscription is basically free because the book retails for $14.99 and I'm paying for postage and handling inside the lower 48 states. On with the show. This is it. In this segment, what I'm going to talk about is about certain Medigap plans. So, in a previous video, you can see it up here on your screen, you'll see the thumbnail to a video about all the different plans and the fact that the main debate for most persons under Medigap is Plans G versus Plan N. Now, you can understand that I'm taking a look up on your screen right now is the fact that this is the Choosing a Medigap policy, which is the official website, the official document, if you will, by the CMS, the Centers for Medicare and Medicaid Services. That's the, whatever it's called, agency that governs Medicare. Anyway, here is the standardized Medigap grid. I'm going to discuss it. It is widely available. You can see it on MaximizeYourMedicare.com as well. It is a standardized grid, standardized and grandfathered grid, meaning that the grid will not change. So, it's been brought to my attention, both, from a particular carrier of Medigap plans, a national carrier, who's recommended that Plan N is better value. I'm not as enthusiastic and wouldn't stop short of that. In other words, the bottom line is you can see the other video that I've also posted with the thumbnail, and there's going to be a link in the text below the video, which is about the original comparisons between these two plans. And basically what it comes down to is a math of money issue, and then comparing the two coverages. So what I really do for clients is basically I'm like a used car buyer. I'm your consultant for that. So I'm checking out this car versus that car. And we know what the model years are, and we know what, et cetera, the mileage is on a particular car. We're trying to figure out whether or not the price differential between used car number 1 and used car number 2 is worth it. This is a math of money issue. Now, I've heard the argument that there's a particular reason for Plan N versus Plan G. Let's go to it here. And basically I will be able to summarize it in a few, with not a very complicated, and it's not going to be very complicated. Well, it might be complicated. Anyway, this is the Medigap guaranteed issue right situation. Okay, so remember, under this video here, 3 ways to get into Medigap, right? There's Medicare open enrollment. There's Medicare guaranteed issue. And then there's the third, which is the one that I've named guaranteed acceptance, which isn't quite, it's kind of a catch-all phrase for ones that are not Medigap open enrollment and not Medigap guaranteed issue. Now, the reason for the rationale for people choosing Plan N and not G is here, which is that under guaranteed issue, you do have the ability to get into Plan G, and you can see it highlighted there on your screen. Notably absent is Plan N, and that is the subtlety. The rationale here is, let's just say, for example, you're sick, and then your retiree benefit plan ends, whatever that would be. Okay? The issue here is that what has been posited to me is that since Plan N isn't in this list, that the only persons that will go into Plan N are those people who are healthy. And G will gravitate all the persons who are sick, basically, right? Because between G and N, here, under Medigap guaranteed issue, you can just get into Plan G. It's very clear, as you can see there on the screen, and you can see it going down here again. Again, Plan G here, Plan G always exists, Plan N does not. Now, don't ask me why they created the rule in this way. I'm the person interpreting the rule, okay? So the idea is that the persons who would go into Plan N are those persons who would qualify under medical underwriting. Whereas Plan G, since there is no medical underwriting under this particular situation, that the sick people will be over here and the healthy people will be under Plan N. Now, the report by the insurance company, National Insurance Company, is that cost of claims is the main driver of future increases. I'm not going to debate that one, right? They're in a better position as far as data goes. I'm not going to debate that one. However, what I am going to debate are the following 2 points. 2 of them. The first one has to do with the cost, with the actual coverage itself. It is here again. We're back to the grid. And what I'm basically going to come up to is that the original video that I sent out about comparing Plan G and Plan N is that kind of, while true, maybe, the fact of the matter is I'm looking at something slightly different, which is, by the way, not mentioned at all under this report/study by the insurance company. So let's just talk about here these 3 stars under Plan N first. This is not complicated. Okay? So under Plan N, in addition to having to pay for the Part B, you can see down here that you can have a copayment for up to $20 for some office visits and up to $50 copayment for emergency room visits that don't result in inpatient admission. I've highlighted it for you there on the screen and raised it to there. My point is, and from the first video what I basically said is, let's just say, for example, you go to the doctor four times. 4 times. And let's just call that then 4 times 20, 80. If you divide 80 divided by 12, you get around $6 a month. And there's your math there on the screen. Under Plan G, you do not pay for this. You can see it here. It only exists under Plan N. So again, for me, comparing Plan G and Plan N remains to be a math of money exercise, because now Plan G is superior to Plan N in this one box, in this row here, because of these 3 asterisks. If you never go to the doctor, you never see this. Granted. But my point here is that then we come back down to the second part, which is not mentioned, and here it is here. This is the Part B excess charge. Now, we've discussed what excess charge is in other videos. Basically, healthcare provider under Part B has the right to charge you above the Medicare approved amount. You are responsible for the entirety of that excess above the approved amount. Plan N, you can see you are responsible for that. Under Plan G, the Medigap policy will cover you. And from here, it gets more subtle. Now I've gone to my trusty easel again, and you'll forgive me because, I haven't caught up to exactly what the best location and app to create this is. But this is basically your payout diagram. Very important here. Payout diagram to Plan G. So you can see down here what I should have done, and what I will do now here is put in this, which is the premium. Okay? So in other words, this represents the cost, right? Because if you start at 0, this amount from the black line to the red line, this is your premium that you are paying for Plan G. All right? Not too complicated. I think that everybody can kind of understand that if you incur healthcare costs, you start getting benefits, and you start getting them rapidly. And you can see it. That is why we have this hockey stick shape, right? Straight up, and it keeps going. And don't get me wrong, I didn't stop this intentionally. I stopped this unintentionally. It keeps going, meaning that you can continue to receive benefits without limit. Now, the issue is the question about how you're going to actually compare it to Plan N. And basically, because of the difference in the grid, the plan starts out and the shape of this curve is slightly different. And let's just talk about it here. Let's just go here. No. And I'm going to change the color in a moment. Just change this color to, blue. There you go. So that's okay. And then we're going to change another one to kind of go here. Okay. Now, why am I having this diagram here under this situation? So we're going to go to it in just a few moments. So let's just put this as Plan N. Okay. Let's turn off this. Why? So you can see what happens here. Under the blue line, you can see it. The blue line, the premium is going to be lower. The premium's going to be lower. You're going to have to pay the Part B deductible. And then you're going to start receiving benefits. Now, the issue about Plan N is the following, is that I could have drawn multiple lines of Plan N as far as the payout diagram goes. And let me just show you. And the reason that I've drawn it in this way, okay, is the fact that this Plan N here, what happens in a couple of instances? Let's just go here. If there's an excess charge, if there are office visits, and you will, don't worry, we'll get to it. It'll appear on your screen in a moment once I stop my incompetence. There you go. So you can actually see there's a difference here, and that's basically what it is graphically for you. It's not necessarily wrong what I've seen in the research. Not necessarily wrong, okay? The issue here, so let's just, I'll try to copy this stuff and then create a new text box over here on this line over here. If there is no excess, in other words, what I'm saying is if there are no excess charge, if there are no excess charges, then yes, that can be the case. That in fact that N has the same payments for the 20% that Part B doesn't cover, for the Part A, the hospitalization deductible, and the copays, coinsurance. All of that is the same for Plan N and Plan G. The issue here is that you can see that the blue lines, there are a couple of different possible paths that can occur on the coverage. Because under Plan N, you can see me drawing a circle around this text. If there's an excess charge or if there are office visits, the amount of your benefit starts to decline when you compare it to Plan G. Under Plan G, there's no debate. There's no office visit copay. There's no emergency room copay. There's no specialist office visit copay once you've met the Part B deductible. In addition to that, under Plan G, if there's a Part B excess charge, again, there's no debate. Plan G covers it. Under Plan N, however, you have these couple of different paths. And now you can continue and go on. Because basically what ends up happening is I can then draw a bunch of other blue lines. Right? We've got something in between. We've got excess charges which are huge, for example. Now the line is even shorter. Okay, well now you have only a couple of office visits and no excess charge. Well, maybe now it's here. In other words, my point to you for this video is the fact that Plan G has more variability. Right? In other words, your value of what you're going to get as far as your benefits go as you can see from the payout diagrams. And I'm fuddling around here because I don't know good at, okay. That plan, I've given up. Plan N has more variability. There are more lines as far as the payout goes. And that is a very important key. Now you can see these different lines, right, as far as the payout, fairly clear. So now the question then becomes ultimately then, okay, what is the difference that you can see today? You can see this area here that I've put in orange. Because this is the financial difference to you today. Okay, so in other words, that you can see the blue line and the red line are different in terms of premium. The premium is different. So actually, we're really back to what I originally said, which is the real question remains. The real question remains still, what is the value of the orange area to you? That's your question. Now, you could say, okay, well, I don't know. But then you could come back to then the math of money. We'll get to that coming up in a moment. So I'm not here to give you a math lesson. And nevertheless, up here is a formula. It's not important to you necessarily that, to decipher exactly what this formula actually is. Let me just say that this is the formula which specifically describes the payout diagrams that I showed to you. And for that reason, that's your link of why you're here on the Maximize Your Medicare channel. I'm deciphering what has to be the way that the payout works. Okay? Financial contracts work by that payout structure. This is not some soft matter, right? It's not. This is the science of estimation. That is how insurance is actually priced. Okay. Now, the fact is that this diagram will change, and now you can understand why I have all of these different lines. Right? Because really what is going on is that the theoretical price, up here you can see theoretical option price, well, that is in fact what insurance is. It's an option. Okay, so as a result, your real question between Plan G and Plan N is a question about these difference in prices here, which have some different probabilities. And the one thing that you have to take away from here is this last line, cumulative nominal density function. That's another way of calling it under the bell curve. That's the math of that formula. Now, what happens over here, right? You have a different price. Of course there are different price. Of course there are. Why? Because all of the different blue lines. No one said this is going to be a slam dunk, a 100% proposition. We don't know if you're going to have office visits. We don't know if you're going to have excess charge. So while the report was out there saying, look, as a result of guaranteed issue versus non-guaranteed issue people, that Plan N is going to have the healthier people. You don't know how many that is, first of all. You have no idea. And the second thing is that they are glossing over this topic right here entirely. And in fact, I've seen one other YouTube video which has tried to make the argument that Plan N is superior to Plan G as a result of what the insurance company said. and trying to say, yes, that is true, and therefore Plan N is superior to Plan G. My statement here on today's video is not necessarily. This is still a math of money question. The orange text here is what's the value of these differences? Unfortunately, what ends up happening is, as a result of that, the report that I read, the YouTube video that I've seen that is making the statement that Plan N is Plan G isn't a complete answer because it doesn't deal with these different blue lines showing up on your screen. For some persons, they're not going to want to deal with excess charge. They're not going to want to deal with the administration of the office visits and whether or not you get a mystery bill. So then it becomes then a math of money question. I didn't say pay $2,000 a year as the value of orange. Right? I'll be the first one to tell you. A client comes to me and says, okay, well, the value of the difference in the premiums, this orange line per year, let's call it $1,000 a year. I would tell them, no, that sounds too high. And you'll have to deal with the very varying blue lines in that instance as long as the client understands. Nevertheless, the world is hyper competitive. And the fact of the matter is, this is why I work as a broker representing all the different plans, because basically what I'm doing is not just comparing Plan G to Plan N from carrier number 1. No. I'm comparing this to carrier number 2. And now all of a sudden, this is not the difference. This is the difference between the blue line and the red line. My point is that blue line minus the red line, $20, $25 a month, $300 a year, that's up to the buyer. That's up to the buyer. I will leave you my specific opinions, ones that I can't share with you in public, up on gh2unfiltered.com. gh2unfiltered.com. It is a subscription website. You can understand that this is pretty sensitive stuff. I find the things that are relayed to you in public and on YouTube, generally speaking, devoid of an acknowledgement of the theoretical understanding about how this diagram actually gets constructed. It also then tells you that when you're sitting on YouTube or reading a quick article or snippet, that if the person doesn't understand the command of this, they are going to be limited in explaining this payout structure to you. That's why you're here on this channel. Hopefully. Oh yeah, and by the way, if you like it, be sure to like and subscribe. Thanks. So this is a fairly complicated topic here today, probably one that you may not have fully understood. Maybe you still don't, in which case please ask your questions in the text below. Let me just have the closing points here. First is that we can speculate that the difference between that Plan G will have higher rates of increases compared to Plan N. However, we don't have evidence of that as yet, number one. Number two is that we also had Plan F versus Plan G in the past, okay, where they had the same difference. You had the same difference between Plan F and Plan G before, meaning that Plan G didn't used to be available under guaranteed issue, right? In other words, this whole, no, I'm not going to have time to do, I don't have, the PDF that I showed you, which had the guaranteed issue grid, told you which plans. In the past, it didn't have Plan G. It now does. Where it did have Plan F. My point is that it is very, it is uncertain. And in the meanwhile, I can press down the difference between the blue line and the red line pretty aggressively, meaning simply by putting carriers against each other, right? That's what I do. I'm cherry picking for you, basically. I'm finding the best of class for both Plan G, Plan N, whatever the plans be, and now comparing these price differences to help you decide for yourself on whether or not this orange area, the value of the orange, is valuable to you. I'd say the last point is this. And it's a rhetorical question. It's an open question. Again, this is not my money. I'm trying to have you understand the rationale on why you'd be choosing a particular selection over another configuration. For example, if the area of orange, for example, is $20 a month, times 12, $240 a year. Okay, that I can understand. No one hands you $240 out on the street. I'm a cheapskate. Got it. But then the question is going to be, look, why am I dealing with Medigap at all? Medicare Advantage will be $1,200 cheaper because I'll be able to find a Medicare Advantage plan at $0 premium. Meaning, back to this orange text here on this slide, which is, this is about assigning price and value to you and whether or not it's worth it. Something that it's not my job to vote on. I don't get a vote. It's your money. But what I would say is that if we were that concerned about $240, why wouldn't I try for the entire $1,200? Right? Because even this $240, this $20 a month difference, for example, let's call it $25, so $300 a year. You can see the blue line has these variable outcomes. The orange line doesn't. For that stability is the question of the orange. Now, if you're going to tell me that $240, $300 a year is all the difference in the world, then I'm going to ask you the question, okay, if that makes the marginal difference to decide, why are we not trying for the full $1,200? Because the money is groceries, utility bill. And I'm not casting judgment here. I'm just saying, let's just assign prices here. You can have counter arguments to that. For example, why would you choose a Medigap no matter what? Well, you live in a location where the networks are so fragmented that you can't find the combination correctly for yourself. That can be a reason. And you have known medical issue. I get it. You need to see a particular doctor that doesn't accept specific Medicare Advantage plans, so your combination of doctors and hospitals doesn't work. Okay, remember, Medicare Advantage over here, PPO means the doctor or healthcare provider, if they take the federal Medicare card, they will be taking your PPO, although your copay, your cost sharing responsibility can be higher if out of network. My point here is that, and I'll stop here because I realize this segment has been pretty long, fairly complicated, is that these differences here aren't just, oh, well, this one rate increase, I'm the greatest thing, and I've decided to, tell you that Plan N is worth it over the long period. You don't have a crystal ball. I don't have a crystal ball. All I can do is report to you about the price here, and then let the consumer decide.